I'm Dr. Rajapriya Ayyappan. I'm a consultant of OBG at Srinivas Priya Hospital, Perambur. And in this COVID times, Mother's Day is coming on May 8th. I'm excited on one side that Mother's Day is a time to be celebrated because motherhood is any day special. At the same time, as a doctor, we have different emotions to deal with. So at this age, we have our elderly mothers whom we have to take care of very specially because we know that the elderly and comorbid people are more vulnerable to the virus. On the other hand, as a mother, we have to take care of our children. It's no longer the role of a doctor. When we get back home, we do not have house help like before. So we have to get into the kitchen, take care of things and reinvent our culinary skills. Now looking at the patient's perspective, what has changed? Now the last 40 days where we have been regularly practicing OBG, we have a huge surge of pregnancies turning patients coming. On one hand, there is an excited couple who are married within 1 or 2 years with a urine test positive, where we have to reassure that it will be fine, they don't have to worry. On the other hand, we have a lot of people because of the lockdown having unwanted pregnancies positive. For instance, even today we had a 48-year-old turning positive and it was an unwanted pregnancy. So it becomes a dire emergency to give them medical pills to help them terminate it safely. Looking at the other point, there is always now the PPE kit on, the mask on, where practically the emotional connect between the mother-to-be and the obstetrician is lost. So a lot of time it is only the reassuring words and the modulation of our tone which helps the antenatal checkups to go on, especially in high-risk pregnancy. And as I am an infertility consultant, most of the pregnancies I am dealing with are precious pregnancies where visiting the doctor, getting her words of comfort is important. However, the emotional connect is highly in a changed perspective because we are not able to see the patient's face and the patient is not able to see the obstetrician face. The more difficult thing is the moment of delivery where so much of curtailing happens. We only allow a single attender. So on one hand, she's so worried that it's a high-risk pregnancy and a precious pregnancy. And on the other hand, we don't allow attenders to be with them. But it is only the support of the hospital staff moving around PPE kits is what she's looking at. But our emotional support continues. So this Mother's Day is very different, but it has become all the more special because we as obstetricians are continuing to enjoy our own motherhood at a different perspective, and we are helping our mothers to be also go through the experience so that she enjoys this special moment of delivery and her promotion to motherhood at an utmost different level but with COVID precautions.